What's up, everyone? I'm back again, and today I want to talk to you about why you should consider dermatology as a potential field for the future. First off the bat, I actually trained in a combined program. So I spent half of my time in residency training in internal medicine and half of my time training in dermatology. Today, I want to talk about dermatology specifically as a specialty, and in the future, hopefully, we'll be able to put together a video about why I decided to go into med derm, the combined training specifically. But today, we're going to focus on all of you future skin doctors out there, and to talk about why I think dermatology is an amazing specialty. So one of the first things that you know about dermatology is that it's a very visual specialty, which I think can be very rewarding for a physician. This is one of those specialties where you can really see disease get better from your treatments. Just from doing all the things that you normally do in a physical exam, you can come to the diagnosis right away and you can give them some type of treatment and literally see the disease get better in front of your eyes. And I think that is so rewarding, especially for the patients to see it and then for you to see it as a practicing dermatologist. That also ties in with the fact that I think dermatology is one of the few specialties now where you can actually own that organ from start to finish. We are the ones that see the disease. We're the ones that do the workup. Maybe that means that we do some blood work, maybe that means we do a biopsy, or maybe we just know what it is based on looking at it. But then after that, we're also the ones that prescribe the treatment. Ultimately, if it's a skin cancer, we're the ones that cut it out, so we get to actually cure that skin cancer as well. There's actually fellowships in dermatology for Mohs micrographic surgery, which means that you can learn some advanced skin cancer removal techniques. There's also fellowship for dermatopathology. So after the biopsy, you could even take that slide and read it yourself if you wanted to. So really, you get to take care of the patient from start to finish. Just compare that to a different type of specialty. Let's say you have a patient who unfortunately comes in with a lung cancer. Well, they might get worked up by the internist who sends a CT scan. So the radiologist reads the CT scan, but then you have to send them to an oncologist to start thinking about chemo, or maybe a cardiothoracic surgeon to get that tumor removed if it's small and limited to one section of the lung. You can see that there's so many touch points for that one particular patient. But if you think about, let's say a person comes in with skin cancer, as a dermatologist, I see it, I diagnose it, I biopsy it, I remove it, and I can even read the pathology for it, and I get to own that one problem from start to finish. And I think it's really rewarding to be able to be that one-stop shop for our patients when they have a skin condition. The next thing that I think makes dermatology really fascinating is its window into the rest of the body. As you know, the skin is a huge immunologic organ. Just by looking at the skin, we can make some really powerful deductions about what's happening underneath the skin. So for example, there's a disease or a genetic syndrome called Birt-Hogg-Dubé. And this syndrome is such an interesting example of this. If I see a patient come in with whitish looking papules on their face, I might think to myself, that looks like it could be a fibrofolliculoma. That patient could actually have this genetic syndrome, which means that maybe this patient could actually have a renal cell carcinoma. And that may be the reason that I send them to get a CAT scan or to get further imaging to figure that out. There's so many stories of this with dermatology. Dermatomyositis is a perfect example. Acanthosis nigricans that happens on the palms, what we call trite palms, is another great example. There's so many things that we can learn about the human body just from inspecting the skin. And being the person that's learned about that and being the person that can make a difference for that patient is really rewarding. The other thing that I think people need to remember about dermatology is we take care of serious diseases. Yes, we take care of acne, we take care of warts, but at the same time, we are also caring for some of the sickest patients that you've ever seen. And you can actually specialize in that. So that's actually my subspecialty. I specialize in complex medical dermatology. So what does that mean? That means that I take care of patients with pemphigus. That means I take care of patients with pemphigoid, or patients, specifically for me, I take care of patients who have life-threatening skin toxicity from their cancer therapy. I belong to a group called the Medical Dermatology Society, as well as the Society of Dermatology Hospitalists, both groups that are dedicated to the care for the sickest dermatology patients that are out there. Additionally, if you're interested, you should check out the American Academy of Dermatology because they have a campaign called Skin Serious, where they highlight all of the different ways that dermatologists have helped save lives, contribute to care, and it's important to remember that we're actually here to help take care of some very serious diseases that can be life-threatening and life-limiting. I don't think it's fair for us to talk about the specialty without talking about some of the obvious things that come with the specialty, and that is the lifestyle that you can have with being a dermatologist. That means that you might not be in the hospital taking overnight call. It might mean that you can work a relatively 8 to 5 job. It might mean that you have more time for your kids, more time for your family. Don't get me wrong, those are all great perks about being a dermatologist. But I'm gonna be honest with you, I think that it is much more important for you to pick a specialty based on your passion, based on what you're interested in, before you think about lifestyle. Personally, I went to medical school thinking there was no way I was gonna be a dermatologist because I had all these misconceptions about the field. I didn't know about all the serious diseases that dermatologists will actually take care of. And so it was actually a rotation in dermatology that I did in medical school that taught me there's so much to this specialty to learn about and to explore that I really encourage all of you to think about at least doing a rotation. The last thing I'll mention is that dermatology is a very diverse specialty, even on a day-to-day basis. What I do in a given work week is completely different. So for example, on Mondays, I'm in the cancer center seeing cutaneous lymphoma patients. On Tuesdays, I spend all day teaching and advising. On Wednesdays, that's my research day, so I spend time basically looking at stata and trying to run different regressions and trying to work on manuscripts. And on Thursdays, I'm seeing those patients in my clinic from morning to afternoon. And these patients are the ones where I'm prescribing them things like rituximab or IVIG or mycophenolate mofetil. These are all drugs that a typical physician might not actually have a lot of access to and have a lot of experience with, but because I specialize in that type of dermatology, I'm used to those medications and I'm used to managing those side effects. And then on Fridays, I'm also in clinic half the time, and I'm doing a lot of teaching on Fridays because I'm in an academic setting. In addition to that, 3 months out of the year, I do inpatient consults for dermatology, where we're being consulted about really severe drug reactions like Stevens-Johnson or Dress syndrome. There's a lot out there in the field, and I just encourage all of you to explore it some more. And one last small thing that a lot of you might not have thought about. If you're interested in academic medicine, dermatology is actually a really great way to think about a career in academics. The reason for that is because there aren't a lot of dermatologists. So the field is relatively small, and on top of that, departments are relatively small. Because of that, it's actually easier to get research done. It's easier to publish. It's easier to get research grants. If you're interested in basic science, just think about the fact that the skin is easily accessible. It's an easy way to actually do translational work because you can do a biopsy, maybe take an extra sample for the lab. And finally, it's actually probably easier to get promoted and to get leadership positions in dermatology just by virtue of the fact that the field is smaller and a little bit more niche. Speaking from personal experience, because the field is smaller, I've gotten to know some really prominent leaders in dermatology just being 5 years out of residency. And that's because everyone knows each other, and it's a really nice community to be a part of. So how can you learn more about dermatology? Well, I think it's important for you to talk to dermatologists to see what type of dermatology is out there. Just because you've met one dermatologist doesn't mean you've met them all. So if you talk to a cosmetic dermatologist, that person is doing something fundamentally different than what I do. I don't even do any cosmetics in my practice. And so I think it's important to realize that there are different types of dermatologists out there. And I think another thing that obviously is helpful is to do a rotation in dermatology. If you're coming from a school that doesn't have a dermatology department, that can be really difficult. So setting up away rotations is extremely important. I know right now, because of COVID-19, there's a lot of restrictions on away rotations. And definitely try to reach out to other dermatologists in the field. And this is where social media is super helpful. Reach out via Twitter, reach out via Facebook, via Instagram. Just try to have those conversations with dermatologists. And it's great to ask them, why did you pick this specialty? Because everyone has a very different answer. I hope this video was helpful for you to think about a potential specialty in the future. I know that most of you aren't going to be dermatologists, and that's okay. Everyone's got to find their passion, and everyone's got to do what they really love to do. A lot of people are scared of dermatology because it's competitive. At least up until now, it's required a high board score and good grades. And while yes, those things are considered in the application, don't let something like a Step 1 score hold you back. If you're interested, at least have those conversations and at least explore the field so you can see if it's truly something that you want to do. Drop a comment below if you're interested in chatting more or if you have more to add to the conversation. Also drop a comment if you'd like to see me do another video for a different specialty. I'm more than happy to try to interview some of my colleagues from other specialties. If this was interesting to you, please consider hitting the like button. And if you'd like more of this content, please consider subscribing to the channel. Thanks again for joining me today. Hopefully I've taught you a little bit more about what dermatology is like as a specialty. There's so much more to explore. I've tried to keep it really brief. Good luck to all of you who are deciding on a specialty very soon. See you later.